Today's topic is Concept and Levels of Prevention. I am Dr. Sabira Dkhar, demonstrator in the Department of Community Medicine, GMC Srinagar. Before we go ahead with the presentation, let's have a look at this short video. Natural history of a disease refers to the progression of a disease process in an individual over time in the absence of any kind of treatment. There are two periods in the natural history of a disease, the period of pre-pathogenesis and the period of pathogenesis. In pre-pathogenesis period, before the man is involved, there is an interaction between the agent, host and the environmental factors. The level of prevention here is the primary prevention, and the modes of intervention is the health promotion or the specific protection. The period of pathogenesis is inside the human host, where we see the interaction of the host and the stimuli, leading to a reaction with early pathogenesis, advanced disease, and a convalescence period. This leads to signs and symptoms, illnesses, disability, defect, chronic state, or death. If the immunity and resistance is seen, then there can be recovery. The level of prevention here is the secondary prevention or the tertiary prevention. The modes of intervention for secondary prevention is early diagnosis and treatment. For tertiary prevention is disability limitation and rehabilitation. As we have seen, the levels of preventions are primordial prevention, primary prevention, secondary prevention, and tertiary prevention. What are the modes of intervention? For primordial, it's the education and the lifestyle modification. For primary, it's the health promotion and specific protection. For secondary, it is the early diagnosis and treatment. For tertiary, it's the disability limitation and rehabilitation. Prevention levels. From the doctor's side, the doctor sees the presence and the absence of a disease. From the patient's side, the patient sees the absence or the presence of an illness. When the disease is absent or the illness is absent, is where we take the primary prevention. That is, the illness is absent and the disease as well is absent. When the disease is present and the illness is absent, that is, the patient has not perceived it, we follow the secondary prevention. That is, illness is absent and disease is present. When the disease is absent but the illness is present, we follow the quaternary prevention. But when the disease is present and the illness is also present, we follow the tertiary prevention. Primordial prevention. It is before the emergence or development of any risk factors. Example, lifestyle modification at a young age in chronic disease, or individual or mass education. Primary prevention.
Primary prevention can be defined as the action which takes prior to the onset of disease. It removes any possibility that the disease will ever occur. In this, actions are taken prior to the onset of disease. It signifies the intervention in the pre-pathogenesis phase of a disease or any kind of health problem. It follows the positive health concept. Example, in cholera, plague, typhoid, dysentery, by raising the standard of living. Public health in primary prevention are immunization, infection control, hand washing, personal hygiene, waste management, water treatment, sanitation, protection of food, water, and supplies. Primary prevention involves two modes of intervention, that is population or the mass strategy and the high-risk strategy. The health promotion and specific protections are the two modes of primary prevention. In health promotion, we see the health education or the nutritional and behavioral change and the environmental modification. In specific protection, we follow the immunization and the supplementation fortification methods. Secondary prevention. It is defined as an action which halts the progress of the disease at its incipient stage and prevents any kind of complications. The specific interventions are early diagnosis and treatment and referral. In early diagnosis and treatment, we have screening tests, breast self-examination, pap smear test, radiographic examination, etc. It protects others in the community from acquiring the infection and is more expensive and less effective in national programs. Secondary prevention involves two modes of intervention, that is early diagnosis and treatment. In early diagnosis, we have the screening test and the case finding. In treatment, we have the medication. Tertiary prevention. It is used when the disease process has advanced beyond its early stages. It is defined as all the measures which are available to reduce or limit impairments and disabilities. It is to promote the patient's adjustment to the irremediable conditions. The intervention should be accomplished in the stage of tertiary preventions are disability limitations and rehabilitations. These are the interventions in the late pathogenesis phase. Tertiary prevention. Impairment is an abnormality or any loss, be it physiological, psychological, or anatomical. Disability means unable to carry out a function which is normal for his age and gender. Handicap means experiencing a certain disadvantage in life. Rehabilitation means a combined and coordinated use of medical restoration of function, be it vocational, social, or psychological. In vocational, it can be to restore the capacity to earn a livelihood. In social rehabilitation, it is to restore a family and social relationship. In psychological, it is to restore a personal dignity and confidence. Tertiary prevention. A disease or a disorder can be seen as an accident. Impairment can be in the form of loss of foot. Disability can be in the form of cannot walk. Handicap means unemployment. Disability prevention relates to all level of prevention, be it primary, to reduce the occurrence of any kind of accidents, secondary, to reduce by appropriate treatment, tertiary, to prevent transition from disability to handicap.
Quaternary prevention. The concept was coined by the Belgian general practitioner Marc Jamol. These are the actions taken to identify patients at risk of overmedication, to protect him from new medical invasion, or to suggest to him interventions which are ethically acceptable. Quaternary prevention is the set of health activities to mitigate or avoid the consequences of unnecessary or excessive intervention of the health system. Summary. When the whole population through public health policy is involved, it is known as primordial level of prevention, where you establish or maintain conditions to minimize hazard to health. This can be done by advocacy for social change to make physical activity easier. When the whole population or selected groups and healthy individuals are involved, it is the primary level of prevention. You prevent disease well before it develops. You reduce the risk factors. This can be done by primary care advice as part of routine consultation. When selected individuals with high risk groups or high risk patients are involved, this is known as secondary level of prevention, where you do early detection and treatment. This can be done by primary care risk factor reduction for those at risk of chronic disease. When it involves patients, it is the tertiary level of prevention. You treat the established disease to prevent deterioration. This can be done by exercise advice as part of cardiac rehabilitation. I hope you have understood the concept and level of prevention, and it has made your concept about this topic much more clearer. Thank you.